Hey guys, welcome to another video. Today our topic is on HIV and AIDS. We'll be covering how the virus is transmitted, the symptoms and treatment. So let's get started. So HIV, also known as human immunodeficiency virus, is a virus that attacks the immune system, which is the body's natural defense against infections and diseases. HIV specifically attacks a type of white blood cell called the CD4 cells, which are crucial for fighting infections. As HIV destroys these cells, the immune system becomes weaker and less able to fight off infections and diseases. AIDS, on the other hand, also known as acquired immunodeficiency syndrome, is a condition caused by HIV. AIDS develop when HIV has progressed to a point where the immune system is severely damaged and the body is unable to fight off infections and diseases. People with AIDS are more prone to life-threatening illnesses, such as certain cancers and opportunistic infections. HIV is spread through the exchange of certain bodily fluids, such as blood, semen, vaginal fluids, and breast milk. The most common ways of transmission are through unprotected sexual contact, sharing needles or other drug infection equipment, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. There is currently no cure for HIV or AIDS, but with proper medical care and treatment, people living with HIV can live long, healthy lives. Treatment typically involves antiretroviral therapy, also known as ART, which is a combination of medications that can suppress the virus and prevent HIV from damaging the immune system. HIV is primarily transmitted through the exchange of certain bodily fluids including blood, semen, vaginal fluids, and breast milk. The most common modes of transmission are, first off, sexual contact. Unprotected sex, including vaginal, anal, and oral sex, is a common mode of HIV transmission. HIV can be transmitted through semen, vaginal fluids, and blood that may be present during sexual activity. The risk of transmission can be reduced by using condoms or other barriers during sex and by getting tested regularly for HIV and other sexually transmitted infections. Second is sharing needles. Injecting drugs with needles that have been used by someone else is a major risk factor for HIV transmission. HIV can be present in the blood that remains on the needle and can be transmitted to the next person who uses it. Using clean needles and other injection equipment such as cotton swabs can greatly reduce the risk of transmission. Third of all is mother-to-child transmission. HIV can be transmitted from an HIV-positive mother to her baby during pregnancy, childbirth, or breastfeeding. With proper medical care and treatment, the risk of mother-to-child transmission can be greatly reduced. HIV-positive pregnant women can take antiretroviral medications to suppress the virus and prevent transmission to their baby, and babies born to HIV-positive mothers can receive medications to prevent infection. Other modes of transmission, although less common, include blood transfusions, organ transplants, and occupational exposure, such as needle stick injuries to healthcare workers. In order to reduce the risk of HIV transmission, it is important to practice safe sex, use clean needles, and get tested regularly for HIV and other sexually transmitted infections. It is also important to be aware of the risk factors for HIV transmission and take steps to reduce those risks. By taking these steps, individuals can help protect themselves and their partners from HIV and other sexually transmitted diseases. Now, symptoms of HIV can vary widely between individuals, and some people may not experience any symptoms at all. However, some common symptoms that may occur within a few weeks to a few months of HIV infection include fever, fatigue, rash, sore throat, swollen lymph nodes, headache, and muscle joint pain. These symptoms may be mild and flu-like in some people, while others may experience more severe symptoms. It is important to note that these symptoms can also be caused by other illnesses, and having these symptoms does not necessarily mean that a person has HIV. As HIV progresses and damages the immune system, more severe symptoms may occur, such as persistent or frequent infections, such as pneumonia or tuberculosis, chronic diarrhea, rapid weight loss, night sweats, and memory loss or confusion. When HIV progresses to AIDS, the symptoms can become even more severe and life-threatening. HIV is diagnosed through a blood test that detects the presence of antibodies to the virus. These antibodies are produced by the immune system in response to HIV infection. There are several types of HIV tests, including antibody tests. These tests detect antibodies to HIV in the blood. Most people will develop detectable antibodies within 2 to 8 weeks of infection, but it can take up to 3 months for the antibodies to become detectable. Second is antigen antibody tests. These tests detect both the antibodies and the antigens. Antigens are basically proteins produced by the virus in the blood. These tests can detect HIV infection earlier than antibody tests alone. Fourth is nucleic acid tests. These tests detect the genetic material or the RNA of the virus in the blood. These tests can detect HIV infection within a few days of exposure, but they are more expensive and not routinely used for HIV screening. It is important to get tested for HIV if you think you may have been exposed to the virus, even if you do not have symptoms. Early diagnosis and treatment can help people with HIV live longer, healthier lives, and reduce the risk of transmitting the virus to others. There are several treatment options available for people living with HIV, including antiretroviral therapy or ART and other medications. These treatments can help people with HIV live longer, healthier lives by suppressing the virus and preventing it from damaging the immune system. Antiretroviral therapy is the most common treatment for HIV. This therapy involves taking a combination of medications that work together to suppress the virus and prevent it from replicating. There are several classes of antiretroviral medications, including nucleoside-nucleotide reverse transcriptase inhibitors, or NRTIs. These drugs, basically what it does is that it will block an enzyme called reverse transcriptase, which HIV uses to replicate. Second is non-nucleoside reverse transcriptase inhibitors. These drugs also block reverse transcriptase, but in a different way than nucleoside-nucleotide reverse transcriptase inhibitors. Protease inhibitors. These drugs block an enzyme called protease, which HIV uses to assemble new virus particles. Next on our list is integrase inhibitors. These drugs blocks an enzyme called integrase, which HIV uses to insert its genetic material into the DNA of host cells. Finally, entry inhibitors. These drugs block the entry of HIV into the host cells by preventing the virus from binding to certain receptors on the surface of the cells. Antiretrotherapy is typically taken as a combination of at least 3 medications from different classes. This is known as combination antiretroviral therapy, or CART, or highly active antiretroviral therapy, also known as HART. By combining medications from different classes, ART can effectively suppress the virus and reduce the risk of drug resistance. In addition to ART, there are other medications that can be used to treat or prevent specific complications of HIV infection. For example, medications may be used to treat opportunistic infections that can occur when the immune system is weakened by HIV. Medications may also be used to prevent mother-to-child transmission during pregnancy and childbirth. Managing HIV and AIDS also involves maintaining a healthy lifestyle, getting regular medical care, and seeking support from others. These can include eating a healthy, balanced diet, getting regular exercise, avoid smoking and excessive alcohol consumption, taking medications as prescribed, getting regular checkups, and seeking support from family or friends. By taking these steps, people with HIV can help manage their condition and live long, healthy lives. So, in conclusion, HIV and AIDS are serious medical conditions that require careful management and treatment. Although there is currently no cure for HIV, there are effective treatments available that can help people with HIV live long, healthy lives. It is important to get tested for HIV regularly, practice safe sex, and take other steps to prevent the spread of HIV. If you or someone you know is living with HIV or AIDS, there are many resources available to provide information, support, and care. Do not be afraid to reach out to medical professionals, community organizations, or support groups for help. Thank you for watching this video and learning more about HIV and AIDS. By spreading awareness and understanding, we can work together to combat stigma and improve the lives of people living with HIV and AIDS. Thank you once again for watching, and as always, I'll catch you in the next video.